Speaking of vaccine gaps, now there is a big debate on when you should take the vaccine if you have been infected with COVID. The new guidelines in India say that you should, if you've been infected with COVID, you should take the vaccine 6 months after recovering. The World Health Organization said 4 to 6 weeks, and until recently it was 4 to 6 weeks in India as well.
Correct. So again, in an ideal situation, I would say after 4 to 6 weeks, one should get himself vaccinated, because we don't know how long your immunity will last, and it can vary from individual to individual. Again, this is based on two factors: vaccine availability and the fact that you do get some protection, and the chance of reinfection once you've had COVID is still very, very low. So you could look at it from another point of view, that if you have got COVID and you have antibodies in your blood, you are protected at least for some time. And if you delay your vaccination, you have two advantages. One is that vaccine would be available to others till we get more and more doses in the country. And secondly, if you delay your vaccination, then the shot that you get later on will give you an immunity which will last for a longer period in time.
Right.
So therefore, you may, if you get your vaccine later, then your immunity will be, let's say, 8 months from that point in time, as compared to if you got it earlier. So therefore, it may help you from that point in time. But like I said, this is an evolving strategy which depends on multiple factors: public health factors, availability, and of course, the issue of whether there is some degree of science behind it.
All right. Dr. Guleria, the other allied question is, what about people who get COVID after their first shot of the vaccine? How long after recovery should they get the second shot?
So this is again an issue which will evolve over a period of time. If you ask my personal opinion, I usually tell them that they should get the second shot after about 4 to 6 weeks. But there are data which suggest that if you've had the first shot, and if you get the infection subsequently, the infection also gives you a booster phenomenon, and your antibodies actually become much better. But since we don't have enough data, I still advise most of my patients to actually get it done after about 4 to 6 weeks to complete their whole course.
All right. That's important clarification, because I think a lot of people are, very confused after the new guidelines have come into place. But, after vaccines, I want to shift our focus now to the oxygen SOS that continues. There are over 70 people who've died in Goa because of shortage of medical oxygen. Once again, this is over 4 consecutive nights. The question that I want to ask you is, this surge in demand for medical oxygen, is it linked to the new variant, Dr. Guleria?
So there is a surge in demand for oxygen based on the number of cases that we're seeing. The variant has caused this surge in the cases to occur at a very short interval. If you look at the current curve, you'll see that it's almost vertical. That means in a very short duration of time, the number of cases has increased so much, and therefore hospitals have not had time to have a turnover. If this curve had risen to even 4 lakhs slowly, you would have a time for turnover. That means those who got admitted on day 1 could get discharged on day 7 or day 10, and then newer patients could be taken in. But if the curve is almost vertical, then you don't have that luxury, and that is creating this huge demand for oxygen. The second issue that I like to really say is that we must also understand that this pandemic is moving. It is moving from one area of our country to the other area. It seems to be moving now towards the east and the southern part of the country, and therefore our oxygen movement should also follow the pandemic. So in areas where now the cases have come down and they are comfortable, their oxygen demand their supply should actually come down in that manner, and it should be given to those areas where there's an increasing demand, so that as a nation we're able to really provide oxygen in a more holistic manner.